I feel more comfortable because I'm in my own surroundings. Every single one of these ladies have been fantastic, and I'm going to miss them. Cry. I've come on in leaps and bounds since I come out of hospital. If it weren't for these ladies, I'd still be in there. I jumped out of bed one Sunday morning. I heard somebody outside screaming. I thought they were in trouble, and I got the terrific pain in my back. I had the ambulance and they took me in, did MRIs and lumbar punctures, and then they figured out what it was. Septic arthritis of the spine. I was in hospital for 3.5 weeks having the drip done. Then they sent me home with oral medication. I lasted 2 days. My stomach wouldn't take the oral medication, and then I went back to ED before I got another bed. It was about another week and a half, and then they put me on to Livewell. I can sleep, I can eat, I can just be me. I feel lucky, because if it wasn't for these ladies, I would still be in hospital taking up a bed that somebody else can use.
Myself and Georgia worked it out of how many bed days you've actually saved for the NHS and how many nights you've been home whilst having a treatment. It's actually 52 days.
Most people will be aware that the health and social care system has been under immense pressure recently, and moving into the winter this is going to be a challenging time. Around 120 people are discharged from Derriford Hospital every day, and whilst the majority of these people will get support to go home from their family, friends, carers, or either community or social care services, there are some people that require some additional support. With this in mind, a number of organisations have come together to provide some additional services to help through the winter.
It's challenging at the moment for everybody. We are often looking at different ways to support the system, so if we can't get people out for assessment only or our home first visits or into placements, we work and use the short-term care centre, another care hotel being opened up, which GTA will be involved in, trying to get those people out of hospital back into the community so we can refer on to the more appropriate teams or agencies or voluntary service if we can do, just try and keep that flow from the hospital for people coming back home.
A care hotel is something new that has just started a few years ago. It's a place where people are coming here to us in order to relieve the hospital beds. What we do here, we are providing the very best of care, 24 hours, 7 days per week. We have excellent caring system, support all the patients that they are arriving to us, encourage them to be more independently so they can go back home, nice and safely.
The reason I went into hospital because I fell over and I banged my head. I'm still required for a further scan, so I've been brought here for further observations. It's more of a home environment than a hospital environment. It gets you more closer to what you are used to at home.
I was in Derriford through having a rather nasty fall. I was unconscious for 5 days and I didn't know it. It meant a complete change of lifestyle, but it also meant you challenged yourself to have a go at doing things a different way. And it leaves you confident enough to say, I'll give it a go as long as there's somebody else in the building.
Brill, well done.
We're doing all right.
We're doing all right, I think so too.
I think so too.
Our ethos is all about bereavement and supporting patients that come and stay with us through their recovery, having had an acute stay in hospital, or to avoid them going in. And we work with them to support them with goals to reduce the need of care when they go home. Staff here really work on the basis of a kind of hand-in-your-pocket service, where we're here to build confidence and support them to achieve what they want to in order to go home safely. Of the time we've been open so far, we've had over 130 patients, and more than half of them have gone home with no care needs afterwards.
There's lots of laughter. You find people making friends. Today we've got 2 people going home. This to me is the ultimate thing. It's to enable, not disable.